Hello, Dr. James Vogash, publisher of Modern Health Myths, and today we're going to delve into another very hot topic as it relates to COVID, children, and our schools reopening. So, going to break this up into both the risk of kids in general, um, the transmission of kids to adults, other experiences of both United States, Europe, and Asia of what has happened when schools have reopened, and then some ideas about what we might be able to do to safely reopen that these discussions don't seem to be um, coming to the surface. So let's start with kids. And the reality is COVID, the loss of any child is certainly awful. And if it was my child, I have a 14-year-old freshman, like any loss of any child is devastating for any reason. But when we're starting to look at um, massive changes to policies, we really have to boil down to the numbers because that's what we've done all along. And to date, we have lost 90 children to COVID. Most of these have some type of pre-existing condition. That doesn't make it okay, but it's the reality. But then we put that in perspective of influenza. There are pediatric experts who say that their kids they'd rather have their kids catch COVID than influenza, because influenza, point blank, is far more dangerous for kids than COVID is. No argument, no discussion. I'm sick of hearing that this is about the kids and keeping them safe, because it's not. We generally lose anywhere from, the ranges the last few years, anywhere from 110 to 187 kids. The estimates of 2017, 2018 for influenza also suggested that that number could have been as high as 600. Far more deaths that we're looking at with COVID. So huge gap between 187 and 600. But if we looked at influenza with the same microscope that we're looking at with COVID, that would certainly make sense that those deaths could be far higher. So we're not even in the same ballpark of the danger of COVID with children versus influenza. And those numbers they're not really arguable. So but then you'll say, oh my gosh, we have these kids with these weird multi-organ system inflammatory conditions that's similar to what's called Kawasaki disease. In other words, their immune system starts to attack itself, and this is awful, and this happens, and we've had 570 kids that this has happened to date. Now, personally, I think that screams vitamin D deficiency, because vitamin D plays a really critical role in protecting, keeping the immune system from over-responding. Generally, darker-skinned kids, Hispanic, Native American, African American, darker skinned usually leads to lower vitamin D levels. But guess what? Kawasaki disease isn't anything new. When you see that report of 500 plus kids, what they don't tell you is 3,000 kids a year develop Kawasaki disease. And that's what's frustrating, is this happens. It's always happened. It's an unfortunate response to a viral illness in some kids whose immune system can't control itself. So yes, this happens with COVID, but damn it, this happens all the time, year in, year out, right now at a level far in excess of what we're seeing with COVID. So please just stop saying that this is more dangerous for the kids, because it's just not. So then the next question, sorry, I just always get frustrated when I hear that this is dangerous for the kids and kids are dying left and right. It's just not happening. Again, any death is awful, but we don't go through this with influenza every year, and yet that's far more dangerous. So really no grounds for that. Then we look at the transmission of kids to adults. So we then, if we send our kids home to school, then they're going to get sick and bring it back to the adults, and the adults are going to get sick and die. We're going to talk about that in a little bit. But again, the transmission from kids to adults is just not that common. It certainly happens, but the numbers are far lower than what most people think that they are. But here's another thing, and I will say this quite strongly. It is not my son's job to protect my health. It is my job. If I don't want him to go to school because I'm worried about him getting sick and bringing it home to me, that is a selfish reason to not send my kid to school. Now, I know that seems harsh, but quite frankly, it is my job to protect my immune system. It's nobody else's. It's not that person in the mask sitting next to me. It's not my child going to school where he should be for his mental health and his developmental and his social interactions and education. It is my responsibility to stay healthy, not my child's or anybody else's responsibility to keep me healthy. That's a harsh statement, but that's the reality, and that's the way that I look at that. So again, it's not the kids' fault. They're certainly being thrown in this, and I can tell you that my son does not like online school. It's certainly what we're doing, but he is not. He misses his friends, and we've had some serious issues and discussions with him because of how he's dealing with this emotionally. So I'm in the middle of all of this, and I would rather see him at school. And this is coming from somebody who has read profuse amounts on COVID, more than probably most parents have, and I have no issues at all with sending him back to school. That being said, so what does happen when we send kids back to school? Because we've got numerous states in the United States. We've had countries in Europe, we've had countries in Asia that have sent back their kids. And you may not want to hear this, but the reality is in almost every scenario, cases go up. Ironically enough, deaths go down around the times that school reopened. Don't have a real answer for that. I'm sure I could think something through, but so that's a pretty clear association across most states, most countries in Europe and Asia that were reported. As always, if you're really interested in looking at the data, there's some nice charts in one of the articles that I will post, and you can easily graphically see arrows going up and down for cases and hospitalizations and deaths. Now, cases are going to go up, period. We can overdiagnose. We're testing, here in the United States, we're testing massive amounts of people. More than any other country. Like, we're going to find it. You test enough, you test people who may have been sick a couple months ago, they may still be shedding some virus. It doesn't mean they're infected, but those tests can come back positive. So I think if you see and look at the data, what's happened in other states and other countries, that it's not that scary, and it isn't this onslaught of just people dropping dead in the streets because we opened school. It just doesn't happen. What we do see, the other thing to keep in mind is when certain states have opened here, what you see is the publicized, oh my gosh, this state, this school district in Georgia had to shut down or quarantine 800 people. Well, that 800 people can be a small percentage. I remember, it may not have been Georgia, but it worked out to be about 2% of the school population. And those people weren't sick. Didn't really describe how many people had been tested positive, but a lot of those were contacts of that person, and that's why we're hypersensitive. If you even looked at somebody from across the field like they're a case, and we need to have them stay home and quarantine. So those numbers are very high because we're really hypersensitive. And anybody who may have even been in the same, zip code, we're going to quarantine them. Actually, that's not considered a case, but CDC generally considers a case within 6 feet for greater than 10 to 15 minutes. Mask is irrelevant at that point, and that is considered a case of somebody who might have potentially been exposed. So those are some ideas and some thoughts about that. And I think people would be surprised if they saw what the numbers really look like in other countries and states that have done this. But again, expect case numbers to go up, but that doesn't mean that the world is falling apart. Let me stress that. Just because cases go up does not mean that the world is falling apart. Again, you will see in most instances that death rates went down when we opened the school for whatever reason, but clearly it didn't lead to people dropping dead left and right. So there's some thoughts on where we're at. So what are some ideas of what we might be able to do when we reopen school? And that's what we're not having. It's kind of this all or nothing. We're just going to throw teachers to the wolves and have them fend for themselves, and there's really nothing we can do to stop the spread. This virus is like a steamroller, and if we just interact the kids and the teachers, they're all going to catch it. Everybody's going to die, and the world will end as we know it. So no discussion about what we might be able to do to kind of to mitigate or to lessen that. Obviously, teachers wearing masks and shields, if they're that concerned, covering everything up so that the risk of exposure is. What I don't ever hear talking about, having classes outside. They did that in the 1918 pandemic, and Arizona here in August, maybe not a good idea, but certainly in the fall, other areas, we could be setting up tents, canopies, things for schools to be had outside, opening windows, those kind of things, making sure ventilation is all proper. And speaking of ventilation, that's another thing that's not being talked about, is that we could certainly set up simple ventilation with HEPA filters mixed in with fresh air, and just like we do in hospitals, just like we do in airplanes. Some costs associated with that, but I'm sure we could come up with some creative ways to do that. Or, back to the outside thing, you just get a giant orange Home Depot fan, put it at one end, and just have all that fresh, free air blowing through. And that would certainly help diminish any potential exposure through the air. So those are some things that I don't. And the other thing that really kind of bothers me is this whole disinfectant. I was just contacted today about somebody from my office that they want to come in and they want to disinfect everything on a bi-weekly basis, whatever the frequency is. And some of these compounds that we're using to disinfect can absolutely worsen respiratory conditions. I have patients who have chemical sensitivities that we'd lose them if we were disinfecting our offices with spray aerosols and everything. So this discussion about wiping everything down, quite frankly, fomites or inanimate objects that carry the virus is not the way that this is spreading. Geez, oh Pete, that's another thing. Spraying everything down, you still can't get damn Clorox wipes everywhere. Even when we're doing that, we're not doing it right because we're spraying stuff down and wiping it right up. It's just ridiculous how we've acted, that everything we may be touching is just brimming with viruses waiting to infect us, and it's just not true. So certainly hand washing, there's no doubt that hand washing can help, and might be wiping down some high contact surfaces, but the idea that we would fumigate these classrooms on a regular basis is gonna create far more issues and challenges than they would save and produce, and as far as lowering infectious COVID spread. So let me close this by saying that teachers aren't the only ones who have been. My practice has been open through this entire thing. You have nurses, you have doctors, you have grocery store workers, you have Walmart, you have Home Depot, other people that have been around and exposed to people on a regular basis, that they've gone and done their work, and for some reason, teachers are a protected class. We don't want to push too hard, but why can't we come up with some way to protect them just like we did for the Walmarts of the world, or in my office, I don't really have much of a concern of interacting with patients and me getting infected. Again, I boil back to the idea that it's my responsibility for my health, but certainly other industries have done a very good job of making sure everything's okay and doing what needs to be done. Our kids need to be educated in a classroom with their peers, developing social interactions. As one of my patients put it, she said her young child needs to be either first grade or kindergarten, I can't remember, needs to understand and deal with the fact that Johnny just stole his pencil. And you can't get that with online. Elementary school kids and online education, just there's no way that's going to be effective. Even high school, like these kids need to be in school. And the social and environmental and everything I've been dealing with my son, I'm not happy about this, and I don't have good answers for him because he can't go interact with his friends in a school setting and meet new people and expand his horizons. So, as always, I welcome comments. I will post any of the references that I talked about in the comments section. And make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.